We continue the discussion with the Right Reverend Mariann Edgar Budde, Bishop of the Episcopal Diocese of Washington, John Garvey, a lawyer and the president of the Catholic University of America, and Harold Dean Trulear, a professor of theology at the Howard University Divinity School. He joins us from Philadelphia, where he's active in ministry to prisoners. President Garvey, one of the things that we're all looking forward to, one of the issues of the next 4 years that seem to be certain to be ones we have to deal with, is the question of health care and how the new health care law will be interpreted. And you've been very interested in that, I know. Tell me about it.
I have been in two ways. In the first place, the Catholic Church has been very interested in promoting the idea of affordable and universal health care for everybody for a long time. So that, I think, is a step in the right direction. One of the unfortunate aspects of the Affordable Care Act is that the Department of Health and Human Services has published regulations that require religious institutions to provide things like surgical sterilizations and prescription contraceptives, including those that cause early-stage abortions, and requiring a lot of religious institutions, including ones like my own university, to pay for this care for their employees and their students. And that creates a real conflict that is an issue of religious liberty for us.
Mm-hmm. And so where's this going?
Well, it's going to court.
Yeah.
For these kinds of things, there are a variety of solutions. There is a legal solution, and we still hope to persuade the department to change the regulations. I think in March there will be some new rules about that. There's a political solution. You know, it was an issue in the election campaign, and then there's the judicial solution. And so we, along with dozens of other Catholic and non-Catholic institutions, have sued, claiming that the regulations in place violate both the First Amendment and the Religious Freedom Restoration Act.
And I would just like to go on record to say that as a woman, I feel it's critically important that all women have access to adequate health care and particularly reproductive health care rights. So I would say that as there are a variety of issues, both spiritually and in terms of public health, that these issues could be looked at. But I, for one, would want all women, regardless of where they work, to have access to the kind of universal reproductive health care that they deserve.
Professor Trulear, I'd like to hear what you have to say. I'm sure it's more than you've already said about guns and guns in the neighborhoods of Philadelphia where you work.
Well, we've just come through a year where our murder rate went back up again, and a lot of it is conflict-based. One of the things that we know about the violence in our culture and the killing in our culture is that, especially in inner cities, it's not just drug or alcohol related. It's related to the inability of people to resolve conflict. That's why I try to frame what we're seeing on the streets in this larger perspective of violent language and inability to deal with conflict or conflicting ideas, even at the political level. It's all of a piece. It's who we are as Americans. And so what we're trying to do is develop solutions in the faith community that enable us to deal with conflict, be able to have people on the street that are also trained in conflict resolution, have our churches and our masjids and our other religious organizations get involved in family reintegration and as one of my colleagues calls it, re-neighboring the hood, making sure that we learn how to be neighbors again, both within the family, within the congregation, and within the community. And it doesn't help us on the streets when politicians are yelling at each other and calling each other names and negative advertising and things like that, because what we're seeing modeled at the highest levels of government is just violence without the gun, and all of it is rooted, in my judgment, in the American loss of the ability to deal with conflict in a constructive way.
How does that sound to you, President?
I think that's a wonderful idea, and there's an odd kind of confluence of these two different discussions that we're carrying on. I think that the work that the professor is doing is something that approaches the problem from the right direction, and he as a person of faith is addressing this as an issue of conflict. He's living out his faith by doing that. One of the subjects of discussion in the debate over healthcare reform has been whether religion is something that we just do in church, whether it's a matter of worship and opinion, or whether it also finds its way into expression in actions like the debate over guns, or like in educational systems or hospitals or social service organizations run by the Catholic Church, the Salvation Army,
or people of faith living out their lives in whatever institutions they serve.
Whatever institutions
I would have to add, however, though, that the proliferation of guns in our culture has created a situation where people, when their emotions are high, when they're in situations of intense feeling, either at home or on the streets or in any other context, have access to guns with such increasing capacity for lethal force that more and more people are arriving, even when they arrive in the emergency room, they're already dead, because the guns that are in their possession and their capacities have grown so lethal. So that, to me, feels like a public health crisis, and a public health crisis warrants a response from all aspects of the community, including the faith community, to say, this must stop. It must stop. And we have to use whatever resources we have at our disposal. And I feel, and I think there's a growing appreciation among the faith communities, that we have been stymied in our capacity to address this issue because of the overbearing influence of the National Rifle Association and the pro-gun lobby. And if you look at public health officials, if you look at the religious community, people working, police officers, they're all saying we've got to address the issue of the quantity and the lethal caliber of the guns that more and more people can access with almost no control. We give more control to people who cut our hair than we do to people who sell us guns, and that must stop.
But so many of us, I think, are kind of worn out by the battle.
I don't think so. I actually think, I personally, again, I feel like it's our job now to create that middle. There are lots, and the two constituencies that can help do this, I'm convinced now, are parents, because we're all worried sick about our children and how we can address them. People of faith that are going to look at this issue from a faith perspective as opposed to whatever convenient other, and to talk to one another about. I mean, the thing about what the president put forth in his initiatives is that they're so reasonable. They are the most reasonable recommendations that a president could put forward, and we're going to fight about them as if they weren't. And it's our job to bring that conversation into a level of truth-telling about what it is. We're not talking about taking away Second Amendment rights. We're talking about safety. Forgive me.
I agree with the bishop about that. I think that both parents and communities of faith are the ones that need to put pressure on the elected officials in this debate. I don't think gun control is going to go anywhere, and I think it's really unfortunate because the president's proposals are reasonable. I also feel as though parents, communities of faith, ordinary people are the ones who need to make the changes in the culture of violence that we have. And while we're on the subject, let me point out that this is the 40th anniversary of Roe against Wade, and we view this as the greatest issue of violence in America today. There have been 50 million abortions in the last 40 years legalized, and it just provides a way of thinking about human life that spills over into everything that we do.
Let me go back to Professor Trulear. Do you want to pick up on this about how parents and churches can be effective in this on this issue?
I think that yes, because what we're experiencing now around this issue is a real sense of crisis. Jim Wallace said the other day, the head of Sojourners, that the psychologists are telling us that we need to hold our children, tell them we love them, and that they're safe. The problem is that they're not, whether you're in Newtown or whether you're in Chicago. So what's happened is we've got an elevated sense of crisis over public safety with regard to our children. And that's now true whether you're in West Philadelphia, where I live, or whether you're in Aurora, Colorado, or in a strip mall in Arizona. And so having this sense of crisis gives us an opportunity to talk together and gives parents of a variety of different stripes the opportunity to say this is a common issue for us. That's no longer an inner city issue. That's no longer an urban issue. That's no longer a black or Latino neighborhood or a gang issue. It's an issue that affects all of our children. And so we have a unique opportunity brought about by crisis. That's one of the reasons that I drew on the Sandy analogy. There are all kinds of people of faith and neighborhood people that are coming together and doing things in the New York area who would never be working together before. And the faith community were the first respondents to Sandy. The faith community was on Far Rockaway days before FEMA showed up. Right. So we have the track record, we have the ability, and we have the sense of crisis. And there's no reason why the faith community and parents and other community individuals can't be at the forefront of having this conversation around violence as well.
I appreciate that the professor was so generous in what he said, because I also think it's frankly, it's a telling indictment of the racial divide in our country, that it took the killing of 30 white children to bring this to the fore, where we've been having a slow and steady killing of children in the streets that has not brought us to this place. And I certainly want to commend him for his work, thank him for his graciousness, and to say that some of us who are coming to this debate now are feeling like we're waking up to a crisis that should have had our attention long ago, and it took something that shattered our sense of security in places of privilege to bring us to this place.
Our time is up. Mr. President, do you have anything more that you'd like to say?
Well, I want to thank you for beginning this conversation. I think it's really important, and I think it's important to direct the attention of all Americans to this issue, to take the one of concern. To me, religious freedom is something that will only matter if religion matters, and so focusing attention on the good work that various religious groups are doing is
well, thank you all. Thank you to Harold Dean Trulear, professor of Howard University. Very good to talk to you again.
Thank you.
Thanks to Mariann Edgar Budde, Episcopal Bishop of the Diocese of Washington, and to John Garvey, the president of Catholic University.
Thank you, Bob.
Thank you.
It's been a pleasure.